Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. Today, I'm in Paris, and I am here with my most Parisian-esque co-host, Dr. Millicent Rovelo.
Bonjour.
How are you doing, Dr. Rovelo?
Ça va.
Ça va bien?
Ça va bien.
We are enjoying the IMCAS meeting, the 25th anniversary edition of this intensely huge, awesome meeting that I think it's just something to behold.
This is probably one of my most favorite meetings to come to. Sorry, ASAPs. Maybe we should edit that out.
No, you're going to leave that in because we're going to be lucky enough to be joined by Melinda Haws, the president of the Aesthetic Society, as it's now known. Used to be ASAPs for those of you following along at home. But we are loving this meeting, and it's been fantastic. You
can't beat this meeting. You can't beat Paris. You can't beat the participants, the energy that's here. Oh, there's Dr. Asher walking by right there.
Yeah, that's right.
The founder of this meeting 25 years ago.
I should go tackle him and get him over here.
He doesn't seem like the tackling type. We don't want to hurt him.
That's true.
We need him.
Like a hip fracture or something. That would be awful.
We need him.
What happened? I don't want to talk about it. We're not coming back again, that's for sure. Yeah. So we are definitely happy to be presenting here, which Dr. Rovelo, you have given 2 lectures so far. You have a moderating session tomorrow to do.
Yes.
I have presented 1 lecture, but I am like the moderating demon on this trip. I've moderated the rhinoplasty session, moderated the live rhinoplasty session today with Dr. Carlos Neves and Nazim Turkish, and then tomorrow I have this massive filler session with Julius Few is on it, Chachi Keo, Stephen Cohen. It's an unbelievable panel, and I'm going to be firing some velvet harpoons at my colleagues just to see what they think.
That sounds really exciting. I mean, the things that we've been able to do so far have just been incredible. Yesterday, I had a how to start a podcast talk, which is actually quite well received. I've been getting people coming up to me today saying, I've been thinking about starting a podcast and I really liked what you had to say and I'm going to go home and do it. So that was, really incredible to see, since we are such a homegrown operation that it was nice to see that we could inspire others to do the same. And I should give my lecture on this podcast about why I should make that a podcast.
You should make that a podcast, but it is important because it's not easy. I think people think they think that I'll just talk into this microphone and people are going to listen. That's actually not the case. It really has to be it's got to be a show. It really is like we're giving lots of information on our podcast. We're teaching, we're educating, but it also has to be fun. It can't be a snooze fest, because who is going to listen to it if it puts you to sleep in 3 or 4 sentences, you're done.
That's not helpful. We can't have you crashing your car on the 405 because you were listening to our podcast and fell asleep.
When I listen to your podcast at night when I try to sleep, it's awesome. You guys are so boring. I'm asleep in minutes.
It's the best. It's like a meditation app.
There was a guy from Poland, actually. I didn't get his name. He kind of like came up to me right as I was about to start the session, so I unfortunately couldn't focus on what he was saying, but he says, I have a similar thing in Poland from Warsaw, so I'm going to try to figure out who it was and hone in on him. But
that's awesome.
He said, he loves our podcast, listens to it, and that's the thing. It's one of, we have a very niche audience for what we do. I mean, this is not going to be Smartless or the Joe Rogan Experience, but if you're interested in aesthetics and plastic surgery, then this is a good podcast to have on your listening queue. It makes sense.
It makes sense, and it's why we're doing it here in Paris at this amazing meeting, which we love. And I was thinking about that when I was trying to speak French earlier. I'm firmly convinced that the more croissants I eat, the better my French will become.
I think that's
the trick to being here and getting better at my French.
Oui, some croissant and escargot.
And before you know it, I'll be fluent.
That's what it's going to take. Well, so far, I have to say that the live surgery I just moderated with, of course, with Sebastian Garçon, and then watching Carlos Neves and Nazim. I learned some stuff from those guys, as I always do, and I knew I would. That's why I was so happy to be in that session moderating, because I saw some cool things that Carlos was doing with ligaments. I watched him do a preservation rhinoplasty, which I think was wonderful. And, you know, I may do something like that someday if I find the right patient for me. He's very good at it. He can do anything with that. You know, Nazem did a very similar nose to him and did it with an open, you know, a traditional kind of structural rhinoplasty, and they both got incredible results. But I learned from both of them simultaneously things that I'm going to take back to my patients, and it's going to make me better for having been here.
1,000%. I was going to say the same thing. I had a body contouring talk. Actually, I think what I need to take back is actually how they say it here. Contouring. I do body contouring.
Body contouring.
Yes, talk yesterday on my massive weight loss patients, and there was a whole panel. So there was, 8, 10, 12 different presenters going up talking about their different techniques and how they do their liposuction and their tummy tucks. And there were several points that I took out of that from probably multiple speakers, and I'm like, oh, that's a good idea. I'm going to do that when I go home, because we all do things similarly, but every country and certainly every surgeon has a different way that they do it. So if you can take even just one of those little tips and tricks from how they do it in Brazil, or how they do it in Spain, or how they even do it in India, it's like, oh, I hadn't thought about that. Because in America we all have different things, but we all go to the same conference, so we all kind of take like similar tips home with us. But getting the exposure to how they're doing it in other countries is just a really different perspective, and you get all kinds of new ideas, which is really exciting.
What did you think about giant liposuction?
Oh yeah, there was this one guy. I mean, I thought I did giant cases. He put me to shame. He was out of India, I believe.
Oh my God! When he said that, I was like,
"Yes,
what in the?" Well, hold the phone, dude.
Because he even said, it's like in America they're very conservative, and they have this number of 5 liters, which is sort of the max amount of liposuction you're supposed to take out of a patient
in the outpatient setting.
In the outpatient setting, he was talking about doing 12 and 18 liters out of people, and he was doing it, he said ICU or a monitored setting. They had blood transfusions on hold for these patients, like aggressive amounts of liposuction. And some of these patients he was even combining with doing excision procedures, so removing skin as well. And the photos that he showed of these patients, I mean, I think any plastic surgeon in America, if they had walked in their doors, would have been like, how about no?
How about no? I mean, they're just, I would never think you could operate on those people. That's why I was like, my eyes flew open on that one when he said, because he said there's the 5,000 liters, then 5 to 8 liters, then 8 to 12, and then 12 and up. And he called that giant liposuction. I was like, I don't, like, that's going to have a mortality rate with it that's unacceptable to me and to my patients. But he didn't really say much about that. He seems to have it down.
He seems to be doing it pretty safely. So, but I mean, he's doing it the right way, in a hospital setting with the anesthesia people on board and having the blood transfusions as needed. And
he's reviewing his results, which I thought was really awesome. But I mean, that kind of stuff we don't see that in the States.
No, I don't think that we are medically, legally equipped to do that.
No, I think
everything that means.
Yeah, I think people would just be like, excuse me, baking powder? What did you do? Yeah, no. You cannot do 18 liters of liposuction in the States and people take you seriously. I think they would just look at you as like you're out of your gourd.
Yeah, but it's things like that kind of make you rethink your standards.
Right.
So it's like, well, maybe we can push things a little more.
Right.
Like everything that comes out in medicine is someone trying something new and reviewing the results and seeing what can be done safely. So maybe there are some limits that we can push after reviewing what other people are doing. So these are all good things to start thinking about.
Safety is key. I mean, that's what we harp on this podcast is patient safety. We talk about it all the time. We talk about making sure that you have all the bells and whistles in terms of when something goes wrong, are you ready for it? Everything, in our surgery center, we're Quad ASF, Medicare approved surgery center that we operate in. We have every safety feature that you could even imagine for every type of scenario that can occur with the types of procedures we do. And you need that. You have to be vigilant about patient safety if you're going to do any of the stuff that we do, number one, but especially if you're going to do like these guys and go to that next level, be prepared. You have to be there, and your patient has to be on board. Everybody has to be in the know of what you're doing and what the potential complications are. There's absolutely nothing worse than people going, oh, I should have had. That's the last thing you ever want to say.
Right. Well, that's the whole point of the meeting and why we're here and why we're learning everything that we are.
We love it. It's great.
We do love it.
Especially now, the gala on Saturday night.
The gala.
This is at some, I didn't look into this too much. I'm sure that it's at some special location.
It's at a pool. So the gala is the pinnacle of this meeting. It's at the end of the meeting on Saturday night, and historically just fantastic. Last year it was at the Opera House, that was sick. I don't know how they're going to beat that. That was awesome. That was incredible. This year it's at this piscine, at a pool. It's the oldest pool in Paris. Been open since the early 1900s as a public pool. Closed down, renovations here and there, but now it's open again as a pool, but also apparently a meeting space. So bring your bathing suits.
Do we need to bring our swimsuits? I have a tux. I don't have a tux swimsuit.
Maybe just wear tux over some Speedos. I don't know.
Swimming trunks. It's Europe. It's going to be Speedos.
It's going to be Speedos.
Ugly. That's how it goes.
So
yeah, you're right.
I don't know. We'll find out tomorrow what this is going to be about.
Well, I'm looking forward to all the other stuff that we get to see. I really want to spend some time on the exhibits, checking out all the different skincare, the modalities, and of course I'm going to be looking for some instrument deals because we got some great instruments here last year.
The Germans make some fine instruments.
I got some sick German scissors that are amazing. Yeah. They're for my facelifts. They're awesome. They're like butter.
We expect nothing less from the Germans.
All right, Mel. Well, anything else we got to talk about today?
No, let's get back out there.
So dropping in with us, of course, is the president of ASAPS, the Aesthetic Society now, Melinda Haws.
That's me.
Yeah.
So glad to be here. This is so exciting to talk in Paris.
So cool to have you on. I was thinking you would be here, and then I saw your name on the docket, and here you are.
I can't believe we worked this out, and I can't believe I didn't forget. And it's so nice to meet you, Millicent. He's told me all about you.
It's a pleasure to meet you in person. We all know so much about you, and we see you on the podium, and it's a great pleasure to actually be able to interact with you in Paris, in person. That's a wonderful. How are you liking the conference so far?
It's really exciting, right?
Yeah.
Very high energy, very interesting, and having all these different groups of people in one spot, I really think adds to the energy. I'm sure the exhibitors love it.
Oh my gosh, the exhibitors here, have you gone around and looked at this stuff?
Unbelievable.
It is ridiculous. I mean, as we always say, we're never going to see it in America because the FDA clearance is unfortunate.
Yes, and the fire marshal. Because they want us to keep everything so far apart, right? Which, safety first, whatever, but
That's true. That's a good point.
It is a good point. I mean, it's just different here.
You can't, there are things that are done here that just can't make it to the U.S. It's just not going to happen. That's for sure.
But maybe we could capture that energy.
The energy is big. And believe me, I've always said, why is there no IMCAS Americas? Why is there no, why don't they do this in Los Angeles or Nashville?
Yes.
Like one of the greatest cities in the union,
right?
Come on.
Absolutely. Couldn't agree more. It's really interesting. There's a bunch of us here from the Aesthetic Society. We're doing a new partnership with IMCAS, and we're having an IMCAS panel at the aesthetic meeting this year. They had an Aesthetic Society panel here this morning. But also, we've opened our meeting now to allied personnel, which is what most of the people here are, and we've opened to cores. So if this is an example of how much energy and how much give and take there is amongst all those groups, it's something we need to aspire to.
Yeah, 1,000%. And if we bring those core personnel and providers into ASAPs, it can only improve the whole spectrum of what we do, rather than making it, us versus them or whatever.
Absolutely.
Yeah.
Absolutely. I mean, we didn't know this back when we were in training in the dark ages. You're too young to know. But we didn't realize the aesthetic space was going to get so big, and that it's now outpaced anything that plastic surgeons can handle on their own anyway.
Yeah.
There's too much demand.
Just look at this place. It's crazy.
Yeah, the demand is why you have so many other specialists coming into this realm, especially dermatology, but then, of course, the oculoplastic surgeons, facial plastic surgeons, and of course just the practitioner who wants to get into aesthetics. I mean, if you've got an eye and you understand anatomy, you can kind of be a great injector. And there's so many people doing it.
That's right. And who's to say someone who went to medical school like us, who became an ER doc or a pediatrician and now is burned out and is turned and wants to learn, why are they not going to be as good or better than our nurse injectors, right?
They certainly can be. It takes training, takes an eye, commitment, all the things that we know to make you great.
All the things we know to make you great. And, and we want to be, the aesthetic side, we want to be a part of training those people.
Yes.
It's all about patient safety, and it's all about good education. But the demand outpaces anything plastic surgeons can do alone. So we need to be a part of, because we're the only ones who can do all of it.
Right.
But we need to be a part of this revolution and part of this change and bring up the standards.
It's happening. Whether we like it or not, it's happening. So we might as well be a part of the conversation and making sure that people are being trained safely. So
I agree.
And I don't think people understand how few board-certified plastic surgeons are dedicated to aesthetics. It's not a big number.
It is not a big number. So, and really, if you look at the active board-certified plastic surgeons in general in the U.S., it's under 8,000. The dedicated to aesthetics members of the Aesthetic Society are under 2,500. And so I'm sure there's some there who do quite a bit of aesthetic, but still, there are 30,000 injectors in the U.S.
Yeah.
30,000.
So the odds are it's not a board-certified plastic surgeon
No,
that's injecting you.
It just can't be. It
That's
just
right.
can't be.
Because everybody wants this stuff. Everybody wants to look great.
Everybody
It's
wants
part of the deal.
it. It's part of the deal. And we don't want someone who's not medically trained, a layperson, injecting free silicone. We saw that happen in the 80s and 90s.
Oh, it's still happening.
And that could happen again, and it
still
could pick up
happening.
speed. If people can't find it,
right.
they're going to find it one
They're
way
gonna
or
find
another.
it some way. No, 1,000%. And when you're talking about, the small number of aesthetic plastic surgeons, even tinier fraction of those are actually doing injections. A lot of us are more focused on the surgery space, so that number gets even smaller. But I mean, we still see horrible injection complications and all kinds of crazy stuff in Los Angeles, but also coming over from Mexico because people go there because it's cheaper. So yeah, we got to get a little better on the safety front.
And the thing is, it could happen to anyone. It could happen to the best injectors. You can get a vascular occlusion, but the trick is knowing what to do when you get it and using a product that you can reverse, hopefully.
And being ready.
And being ready to reverse it. And so if you don't, and that's, as surgeons, we learn that. You know how not to get into trouble. You know what the complications are if you get in trouble, and you know how to face it. And that's how we go to the OR every day, because we know we can handle whatever might happen. We need to prepare injectors that way.
Well, Mindy, it's awesome having you here as the president of the society. We appreciate you jumping on with us. Tell us, what has been the biggest, when you came here, you went, I didn't know that. Because that happens to us every time we come. Every time I've been here, I've been like, oh, I get that.
I had no idea. I mean, I know that there are different skincare companies and different device companies outside the U.S. I know that. I had no idea how many. I had no idea how many great ones and how busy they are, and how again, and you read how big this space is, and I know how big it is in the U.S. This is worldwide.
Yeah, this is a whole different animal. And we were talking about this last night, that I feel like in Europe and Asia, they are better or more focused on skin care than we are in the States. So going and getting a facial every week or every month is very much part of your routine, the same way you might get your nails done every few weeks. They are way more skin care focused, and I think that shows in all of the different brands that they have available to them.
Yeah, I think that's a very good point.
Yeah.
I think it's a very good point. And it is so important. I mean, and we see, Botox. We're now really kind of talking preventative Botox. And it does change how we age. Thank God it came out 20 plus years ago is all I can say, right? I'm almost 20, I think I am a 25-year user. So it's changed how
1,000%,
I age.
yes. No, but that's it. That's what this meeting is. It was historically about aging, about the science of aging, and then it has just turned into this incredible behemoth of a meeting that's now roped in the plastic surgeons and the products and the vendors. And gosh, if we could bring even a quarter of this back to ASAPs and to the States, it would be huge.
It would be huge.
That is going to be your job.
I'm working on it. I'm working on it. Yeah, it is. It's a lot. It's a hard one, but it's just we got to open our eyes to what clearly is very popular and needed. It's needed.
Yeah, 1,000%.
Well, Mindy, I think, we've taken a lot of your time. We really appreciate it. I hope that, not only do we have this conversation, but that we kind of make good on it, because I'm a big fan of this conference, have been here, I think, since 2006, actually. It was probably my first one, or either 6 or 7. And the surgical stuff has come to a new level. The live surgery stuff is done very well here. I enjoy it. And I think there's a lot to be learned for the Aesthetic Society and any of our plastic surgery conferences.
We're all better together, right? We should be, we're a global community now with the internet. We need to be global aesthetics. So let's do it.
Let's do it.
All right. Thanks for having me.
It's been a pleasure. Thanks for coming.
It's my good friend Alex Schoenborn, the president of the German Society for Aesthetic Surgery, or the German Aesthetic Society. Clarify for me so I get it right.
Yeah, thanks. Great to be here. I'm actually the vice president, or the president-elect, and the name of the association is Association of German Aesthetic Plastic Surgeons.
So I missed completely.
No, you didn't at all.
I wasn't even close.
It's basically, we are German, so it has to be a kind of a complicated name.
Very
but
good, I like
it's
that.
the equivalent of the Aesthetic Society, if you want to.
So we met at IMCAS, and then I came out to a meeting with you, and
Yeah.
how long have you been coming here?
I think it's my 5th year in a row. First time I was here in 2019, and then I think due to COVID there wasn't an IMCAS in 21, but it's the 5th time in a row that I'm here.
Yeah, I think I've been coming here since I was like 8 years old. It
Oh,
seems
okay.
like forever. This is the 25th anniversary, and it's
Yeah.
a blast. I mean, Dr. Rovelo, what's this is like your 2nd or 3rd IMCAS?
This is my 3rd IMCAS, and each year I look forward to it, and I can't wait to come back. I'm sure you have a similar feeling with it. How did you get involved with IMCAS?
Well, actually, when I was a medical student, I spent 2 years in Paris at medical school, and then 2 years of my residency here in Paris with Vladimir Mietz. So I kind of stayed connected to Paris, and it's to be honest, in the beginning it was kind of a pretext to come to Paris going to a congress. But that's where my connection with Paris and friends comes from.
Got it. And tell us a little bit about where you practice and what you do. What's sort of your specialty?
I'm practicing in Berlin, in Germany, and I'm mostly doing breast surgery and some face surgery. But the main focus, I would say, is breast surgery. Some surgery after massive weight loss. I think you call it body contouring.
Right.
Those are my main interests.
Good. That sounds like we have sort of similar practices. That's what I know. I do a lot of breast and the body as well. And Dr. Calvert here does a fair amount of faces.
I do a few noses as well, and Vladimir Mintz is he just is an amazing guy. We were really happy I was happy to spend time with him at your meeting, and especially to be on the panel with him about facelifting and talking about deep plane facelift and the SMAS, because really it's Mitz and Peroni that were the guys that described the SMAS, and so to be in that meeting with him was really quite special.
And he's still fully active. I saw him this morning doing a facelift at the Kling. I mean, he's 81 years old, and he's still so incredibly fast. That's always a pleasure seeing someone like him operating.
Well, he's a dynamic guy. He's obviously got, he was sharp as a tack. I mean, really smart, completely dialed in, asking big questions. I just think anybody out there who's talking about the deep plane facelift or SMAS lift or whatever permutation of the facelift approaches has to know about Vladimir Mitz.
Yeah, that's true. Yeah.
Yeah.
And he's, I'm sorry.
Go ahead.
And he's still, what I like about him, he loves to teach, and he loves to explain what he does, why he does it, and I think that's a rare quality, especially among all the colleagues. I'm sorry for interrupting you.
No, absolutely. And to piggyback on that, I think that's one of the great things that we're seeing at this conference here is how much everyone really is invested in teaching and sharing their techniques. They're not holding on to them or keeping them a secret. So doing all the live surgeries and all of those lectures and presentations have been really exciting to see.
Yeah, that's true.
What are you looking forward to seeing in the rest of your time here?
Tomorrow there's a session on breast surgery, which I will attend. Later this afternoon, I've seen a session on lips. I think it's not lip surgery, but lip enhancement, which I found interesting. Those are the two sessions I would like to attend.
I think I'm moderating the breast one tomorrow,
great.
So I will see you there for sure. I'm also looking forward to seeing what people are going to be talking about, and then I think there's a smattering of some face panels after that I'm looking forward to.
Well, and also our colleague Chachi Keo has got a live surgery today at 2, where he's doing the cadaver work. He's already filmed the live surgery, and they're going to be moderating that at 2 p.m. up in Bordeaux, which is really cool. And it's an incredibly huge meeting with, I think he said 18,000 people here. Is that right?
Yeah, it could easily be. I think last year was 13,000, so
Yes.
easily
it's massive.
possible.
They sold out. It's crazy. But, you know, I just love the new tech. Of course, new tech we're never going to see in the United States, but that's okay. We get to enjoy it anyway.
Yeah. And not to forget about the gala dinner tomorrow, the very famous location
The pool. Yes.
at an old swimming pool. That was when I was in Paris. It was still closed. I think it just opened a couple of years ago, and it seems like an amazing Art Deco place.
Yeah, I'm looking forward to that. The galas here are always just ridiculous, like in a really good way.
Well, I actually got a new tux for the gala, so I'll be sporting that.
You have to.
I got to keep up with this one, who's the fashionista of the century. So, well, listen, Alex, thanks for dropping in with us.
Thank
we
you.
really appreciate it, and we'll look forward to seeing you around IMCAS.
It was a pleasure.
All right. Well, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 17th arrondissement? 17th?
I think it's 17th. It is the 17th because we went to dinner at a 17th from the 17th arrondissement.
Oui. Au revoir.